we are facing significant workforce shortages and recruitment challenges that make it harder for independent practices to compete with large systems. But amid this turbulence, there is golden opportunity. We are entering a period where value and verification matter more than volume. Payers, employers, and patients all want proof of diagnosis, proof of effectiveness, proof of cost control. Clinics that remain just therapy providers will continue to compete on price. Clinics that evolve into diagnostic centers of excellence will compete on expertise, accuracy, and results. And I repeat that. Clinics that remain just therapy providers, no matter how small or big those clinics or organizations are, still they will continue competing on price. However, clinics that evolve, smaller or bigger clinics or organizations, into diagnostic centers of excellence will compete on expertise, accuracy, and results, opening the door for greater opportunities in the healthcare system. So diagnostics, therefore, are no longer an optional add-on. They are a strategic necessity, both clinically and economically. By integrating EMG nerve conduction studies and musculoskeletal ultrasound, you elevate your role from a therapist to diagnostician, and from just a provider to a partner in care. You strengthen your relationships with referring physicians and employers, and you make your practice indispensable in a value-driven healthcare system. Within HODS itself, this has been a year of pivotal transformation. After careful consideration and strategic evaluation of market conditions in New York, Kostas and I made the decision to sell the physical therapy component of the hands-on organization to Confluent Health Motion PT. This decision allows us to sharpen our focus and what truly defines our future: hands-on EMG, hands-on diagnostics, Catalyst, physical therapy and diagnostics, and the continuous elevation of our educational and clinical mission. Far from a conclusion, this is an expansion, one that will enable faster growth, broader partnerships, and deeper impact nationwide. We are now working on new nationwide initiatives that will positively affect all HODS members. Two of these programs are already underway. One is diagnostic testing programs in assisted living facilities, where HODS members bring EMG and MSK ultrasound directly to older adults to detect neuropathies, muscle atrophy, and fall risk before they lead to disability. And number two, preventive diagnostic programs for employers using EMG and ultrasound to identify early signs of muscle or nerve overuse before injuries occur, improving workforce health and reducing compensation costs. These initiatives represent the next phase of what we've always believed. Diagnostics are not only about treating disease, but about preventing it. On top of that, to help in the faster dissemination of diagnostics across the country, we are introducing an introductory 2-day EMG course that will be available at a low cost to healthcare providers and totally free to HODS members and their staff. One of the most important developments of this year came from APTA, which officially announced the creation of a primary care physical therapy certification program through ABPTS, with the first examination planned for 2028. This is a monumental step for our profession. For decades, we have advocated that physical therapists should be recognized as primary access providers, the professionals who patients trust to evaluate, diagnose, and manage musculoskeletal and neuromuscular conditions from start to finish. But primary care physical therapy cannot exist without diagnostics. EMG and ultrasound empower physical therapists to deliver faster, more accurate, and life-changing care. These are the tools that make primary care physical therapy real, tools that transform the therapist into the diagnostician, the clinician of first resort, not last. That is why I am announcing for first time that before the end of this year, HODS will formally apply for candidacy with ABPTRFE to establish a residency program in primary care physical therapy. This will open new exciting opportunities for our members. The ability to pursue dual residencies in clinical electrophysiology and primary care physical therapy, achieving an even higher level of recognition and influence in your communities as the primary care diagnostic physical therapists. You will be the professionals patients seek out first, the clinicians capable of managing the entirety of musculoskeletal conditions from diagnosis to treatment to prevention.